This is the humeral bone. So when we talk about the humerus bone, you will find it's a long bone. Okay, long bone. It has the two ends, upper end, lower end, and shaft. Okay. So upper end, lower end, and shaft. It is the right-sided humerus. It is a right-sided because the upper end bears a head which is directed upwards, medially upwards and backward. Medially upwards and backward. So it is the upper end and it is directed to medially upwards and backward. Lower end is expanded to form the epicondyles, side to side to form the epicondyles. Okay. So lower end is expanded. Upper end bears a head which is directed upwards, medially and backwards. Okay. And posterior part of the lower end bears a fossa that is called as olecranon fossa. So by these 3 points you can rule out that it is the right-sided humerus bone. Okay. Now when we talk about the upper end, you will find the head which articulates with the glenoid cavity of the scapula. Okay, glenoid cavity of the scapula. This is the left side. So glenoid cavity of the scapula, head is articulates with the glenoid cavity and form the shoulder joint. Okay. Head is separated from the rest of the upper end. Rest of the upper end, say ये head जो है separate रहेगा, separated by a line that is called as anatomical neck. So you will find a line which separates the head from the rest of the upper end that is called as anatomical neck. Okay. So this is a line which is called as anatomical neck which separates the head from the upper end, rest of the upper end. And the line, imaginary line which separates the upper end from the shaft is called as surgical neck. So you will find here is the imaginary line which separates the upper end from the shaft. So that is called as surgical neck. So 2 necks are there. Okay. So first of all we have seen the head and anatomical neck and surgical neck. At the upper end you will find the 2 bony tubercles that is called as greater tubercle. Large tubercle is called as greater tubercle. It is found on the lateral side. Okay. And at the anterior side you will find a lesser tubercle which is small tubercle that is called as lesser tubercle. So 2 tubercles are there, lesser tubercle and greater tubercle. There is a sulcus in between the 2 tubercles that is called as intertubercle sulcus, or it is also called as bipedal groove. Now when we talk about the greater tubercle, you will find the 3 impressions here. So at the topmost you will find the upper impression, in the middle you will find the middle impression, and the lower part of the tubercle you will find the lower impression. Upper impression, middle impression and lower impression. This is meant for the attachment of some muscles, okay? Insertion of some muscles, okay? We'll talk about it later. Now what we have seen in the upper end, we have seen the head which articulates with the glenoid cavity of scapula, from the shoulder joint, anatomical neck which separates the head from the upper end, and surgical neck which separates the upper end from the shaft. And we find the two types of the tubercle, small tubercle, lesser tubercle, large tubercle, greater tubercle, and the sulcus between them that is called as intertubercle sulcus or bicipital groove. We have also find the 3 impression on the greater tubercle, that is the upper impression, middle impression and lower impression. Done. So upper end is done. Now we come to the shaft of the bone. So we'll find the shaft has the 3 borders and the 3 surfaces. Okay. So you'll find the shaft has 3 borders and 3 surfaces. So you will find the anterior border, medial border, and lateral border. Here you see anterior border is continuous at the lateral lip of the bicipital groove. So when we talk about the bicipital groove has the lateral lip, medial lip and floor. Okay, 3 parts of the bicipital groove: lateral lip, medial lip and floor of the. So anterior border you will see that the anterior border continues as a lateral border of bicipital groove, और bicipital groove का lateral lip है वो anterior border में continue हो जाता है, join कर देता है. Medial lip of the bicipital groove continues as a medial border of the bone. So medial border जो है it is continuous with the medial lip of the bicipital groove. And you will find that here is a lateral border also. So 3 borders are there: anterior border, medial border, lateral border. 3 surfaces will be there: anteromedial surface, anteromedial surface, anterolateral surface, and posterior surface. So anteromedial surface will be between the anterior border and medial border. Anterolateral surface will be between the anterior border and lateral border, and posterior surface will be between the medial border and lateral border. Okay, posterior surface. Now we come to the lower end. Lower end is expanded and it forms the 2 epicondyles. So medial and lateral epicondyle. So you will find that the medial epicondyle is more prominent than the lateral one. At the lower end you will find a rounded part that is called as capitulum. Articulates with the head of the radius. This is the radius bone. So this is the head of the radius bone. Capitulum articulates with the head of the radius bone and form the elbow joint. है ना? क्या बनाएगा? Elbow joint बनाएगा. And a pulley shaped structure that is called as trochlea articulates with the trochlear notch. Here is the trochlear notch in the ulna. This is the trochlear notch of the ulna. It articulates with the trochlear notch of the ulna and forms the elbow joint. This is the compound joint. Okay, so more than 2 bones are joining here. So one is the humerus and one is the radius and ulna. 3 bones are joining here. So the elbow joint is a compound joint. more than 2 bones. Okay. So you will find the capitulum which articulates with the radius, trochlea articulates with the trochlear notch of the ulna, and from the elbow joint and just above the capitulum you will find a fossa that is called as radial fossa because it articulates with the radius. Radius is on the lateral side. So radius is on the lateral side. So the capitulum, just above the capitulum you will find fossa that is for the accommodation. The fossa is for the accommodation of the head of the radius, so that is it is called as radial fossa. On the flexion of the elbow joint you will find the head will accommodate here at the radial fossa. Okay, so this is the radial fossa. At the ulna you will find a process, two processes are there, coronoid process and one is olecranon process. When the trochlea is articulates with the trochlear notch, there is a one fossa just above the trochlea and which is for the accommodation of this process that is called as coronoid process. So this fossa is also called as coronoid fossa. So at the anterior side of the lower end you will find the two fossas just above the capitulum radial fossa, just above the trochlea you will find the coronoid fossa. The behind one large fossa is there for the this process of the ulna that is called as olecranon process. To accommodate this process, this fossa is called as olecranon fossa. Olecranon fossa. During the extension of the elbow joint, this olecranon process will accommodate this olecranon fossa. So at the lower end you will find the three fossas: capitulum just above the capitulum, radial above the trochlea, coronoid, behind olecranon fossa. Three fossas are there. Done. Bony projection, medial epicondyle, lateral epicondyle, capitulum, trochlea, radial fossa, coronoid fossa, olecranon fossa. Done. Just above the epicondyles, there is the sharp border, sharp lateral border that is called as lateral supracondylar ridge. Medial border just above the medial epicondyle that is called as medial supracondylar ridge. This was all about the features of the scapula. And at the posterior surface, okay, one more thing is there. There is a tuberosity on the lateral side that is called as deltoid tuberosity. Okay, at the lateral surface you will find a tuberosity that is called as deltoid tuberosity. Posterior surface, at the posterior surface you will find groove which is from the going downwards from medial side to the lateral side that is called as radial groove. This is for the accommodation of the radial nerve. Okay, so radial nerve will pass from the posterior surface from medial to the lateral side and the groove that is called as radial groove. So at the posterior surface